Here is the real reason your sciatica pain never fully goes away, and why every single treatment you have tried has only given you temporary relief before that burning, shooting nerve pain comes crawling right back. Your sciatic nerve is not just compressed, it is inflamed, deeply, chronically inflamed at a cellular level. And until you attack that inflammation directly from the inside out, every injection will wear off. Every painkiller will stop working. And every single morning you will wake up with that same fire running from your lower back all the way down to your toes. But here is what changed everything for my patients. Every single morning before breakfast, before coffee, before anything else, they drank one simple glass of warm turmeric ginger lemon water. Just that, made in their own kitchen, costing less than $1 a day. And within 60 days, most of them barely recognized their own pain levels. I am Dr. Ryan Mitchell. And after 22 years of treating spine and nerve conditions, this morning drink is the most powerful thing I have ever added to a sciatica patient's daily routine. Stay with me, because what you learn in the next few minutes could completely change the next 2 months of your life. Before I show you everything, I want you to do one thing right now. Scroll down to the comments and drop your age and your city. Just those two things. I read every single comment personally, and I want to know exactly who is watching this video today. Drop it right now before you forget. Age and city, I will be reading them after this video goes live. Now, let me explain something to you that most doctors simply do not have time to walk you through during a 12-minute appointment. Your sciatic nerve is the longest, widest nerve in the entire human body. It originates from 5 nerve roots in your lower lumbar spine, and it travels through your hips, through your buttocks, and all the way down both legs to the very tips of your toes. When something goes wrong with this nerve, a herniated disc pressing against it, a bone spur irritating it, a tight muscle squeezing it, the pain that results is unlike almost anything else in human experience. You know exactly what I mean. That sudden electric shock when you stand up from a chair, that deep, aching throb in your lower back that never fully disappears. That burning, crawling sensation behind your knee that wakes you up at 3 in the morning. That numbness in your foot that makes you feel like your leg belongs to someone else. Now, here is where the medical system fails you. When you walk into a doctor's office with sciatica, the conversation almost always follows the same script. They look at your MRI. They find the herniated disc, or the bone spur, or the narrowed spinal canal. They prescribe anti-inflammatories, muscle relaxers, or refer you for physical therapy. If the pain is severe enough, they send you for an epidural steroid injection. And sometimes those things help for a while, but then the pain comes back, and you return to the office and the cycle repeats. Here is what that cycle is missing. Even after the physical compression is addressed, even after the disc inflammation goes down, even after the muscle releases, your sciatic nerve itself remains in a state of deep, chronic cellular inflammation. Think of it this way. Imagine your sciatic nerve as a garden hose. A herniated disc is like someone stepping on that hose. The water stops flowing. Removing the compression is like lifting the foot off the hose. But if that hose has been kinked and stressed for months or years, the hose itself is damaged. The material is weakened. It needs to be repaired from the inside. That is exactly what chronic sciatic nerve inflammation is. And that is exactly what this morning drink is designed to address. Before I give you the recipe, I want you to understand the strategy behind it, because this is not just a random collection of healthy ingredients thrown together. There are 3 specific biological targets we are hitting every morning with this drink. The first target is inflammatory cytokines. These are the chemical messengers your immune system releases that trigger and sustain inflammation around your sciatic nerve. When cytokine levels stay chronically elevated, the nerve never gets the chance to calm down and repair itself. Several of the ingredients in this drink are clinically shown to reduce cytokine activity directly. The second target is nerve tissue nutrition. Your sciatic nerve needs specific nutrients to repair its myelin sheath, the protective coating around the nerve fiber that gets damaged during chronic inflammation. Without these nutrients, even if the inflammation reduces, the nerve signal transmission remains disrupted. We are feeding the nerve exactly what it needs to rebuild. The third target is microcirculation. The tiny blood vessels that supply your sciatic nerve with oxygen and nutrients become constricted and sluggish during chronic inflammation. Poor microcirculation starves the nerve of the healing resources it needs. Several ingredients in this drink are proven vasodilators. They open up those tiny vessels and flood the nerve with fresh, oxygenated, nutrient-rich blood. Now, why morning? Why on an empty stomach? Because your gut lining is most permeable and most receptive first thing in the morning, before food creates digestive competition. The bioavailability, meaning the percentage of nutrients that actually reach your bloodstream, is dramatically higher when you drink this before your first meal. The morning timing is not optional. It is the protocol. Now let me walk you through every single ingredient and exactly what it does inside your body. The first ingredient is warm water, 8 to 10 ounces. Always begin with warm water, not boiling, not cold. Warm water gently activates your digestive enzymes, relaxes your gut lining, and begins vasodilation in your peripheral blood vessels. It prepares every system in your body to receive and absorb what follows. Think of it as opening the gate before the healing compounds walk through. The second ingredient is turmeric, 1 full teaspoon. This is the most important ingredient in the entire drink. Turmeric contains a compound called curcumin, and curcumin is one of the most extensively studied natural anti-inflammatory substances on Earth. Research has demonstrated that curcumin inhibits a molecule called nuclear factor kappa B, which is the master switch that activates the inflammatory cascade surrounding your sciatic nerve. When this molecule is blocked, the chain reaction of inflammation is interrupted at its source. Some studies have shown curcumin's anti-inflammatory effect to be comparable to prescription anti-inflammatory drugs without the gastrointestinal damage, without the kidney stress, and without the dependency that comes with long-term pharmaceutical use. 1 teaspoon every morning, non-negotiable. The third ingredient is black pepper, just 1 pinch, approximately 1/8 of a teaspoon. This ingredient is the reason most people's turmeric supplements do absolutely nothing for them. Curcumin in its natural state is poorly absorbed by the human gut. Without intervention, up to 85% of the curcumin you consume passes through your digestive system without ever entering your bloodstream. Black pepper contains a compound called piperine, and piperine increases the bioavailability of curcumin by up to 2,000%. That single pinch of black pepper transforms this drink from mildly helpful to genuinely powerful. Do not skip it, ever. The fourth ingredient is fresh ginger, 1/2 inch grated or 1/2 teaspoon of powder. Ginger contains active compounds called gingerols and shogols that independently reduce nerve inflammation through a separate biochemical pathway from curcumin. This means they work together synergistically, hitting inflammation from 2 different angles simultaneously. But ginger does something else that is critically important for sciatica patients specifically. It is a powerful natural vasodilator. It opens up the small blood vessels supplying your lower back, your sciatic nerve root, and your leg, dramatically improving the delivery of oxygen and healing nutrients to the exact tissue that needs it most. The fifth ingredient is lemon juice, 1/2 a fresh lemon squeezed directly in. Freshly squeezed lemon juice serves 2 critical functions. First, it shifts your body's internal environment toward alkalinity, and inflammation at a cellular level thrives in an acidic internal environment. Reducing acidity directly reduces the conditions that allow chronic inflammation to persist. Second, lemon juice is rich in vitamin C, and vitamin C is absolutely essential for the production of collagen. Collagen is the structural protein that forms the discs, ligaments, tendons, and connective tissue surrounding your sciatic nerve. Always use fresh lemon. Bottled lemon juice has been pasteurized. The heat destroys the enzymes that make it effective. The sixth ingredient is raw honey, 1 teaspoon. Raw, unfiltered honey contains natural enzymes, antioxidant polyphenols, and trace minerals including zinc and selenium that support tissue repair and immune modulation. Beyond the biochemistry, it makes the drink genuinely pleasant to consume every single morning, and consistency requires enjoyment. Always add the honey after the water has cooled slightly, because high temperatures destroy its beneficial enzymes. And the optional add-in, if your sciatica is accompanied by muscle spasms, leg cramping, or restless legs at night, add 200 to 250 milligrams of magnesium glycinate powder to your morning drink. Magnesium is the body's natural muscle relaxant, and plays a direct role in nerve signal transmission. Deficiency in magnesium affects an estimated 50% of adults and directly worsens nerve hypersensitivity and muscle tension around the sciatic nerve. Here is the exact preparation method. Boil fresh water and allow it to cool for 3 to 4 minutes. Pour 8 to 10 ounces into a mug. Add 1 teaspoon of turmeric powder and stir. Add 1/8 teaspoon of black pepper and stir. Grate fresh ginger directly into the mug or add half a teaspoon of ginger powder. Squeeze in the juice of half a fresh lemon. If using magnesium powder, add it now and stir thoroughly for 30 to 45 seconds. Allow the drink to cool for 1 additional minute. Add 1 teaspoon of raw honey and stir gently. Drink slowly over 5 to 10 minutes. Total preparation time is under 3 minutes. Drink this every morning within 15 minutes of waking up, before coffee, before food, before anything else. This is your new first act of every single day. Now, I want to stop here and tell you about someone, a real patient, someone whose story I think about often. His name is Robert. He is 67 years old. He spent 34 years working construction in Pennsylvania, decades of heavy lifting, concrete work, carrying materials up scaffolding, and all kinds of weather. By the time Robert came to see me, he had been living with sciatica for 6 years. 6 years. He described the pain to me the way many of my long-term sciatica patients do. Not as something that happens to him anymore, but as something that had become him. He said to me directly, "Dr. Mitchell, I do not remember what it feels like to not be in pain. I have forgotten what normal feels like." Robert had received 4 epidural steroid injections over those 6 years. The first 2 gave him meaningful relief, 3 months, maybe 4. The third one gave him 6 weeks. The fourth one did almost nothing. He had completed 2 separate courses of physical therapy. He was taking prescription muscle relaxers at night just to get 3 or 4 hours of broken sleep. His wife had started sleeping in the guest room because his restlessness was keeping her awake. He had stopped fishing, something he had done every weekend for 40 years. He had stopped attending his grandchildren's baseball games because the bleacher seats were impossible. He had gained 20 pounds because movement had become so painful that his world had shrunk to his recliner and his bed. When he sat across from me in my office, he was not angry. He was just exhausted, deeply, completely exhausted by pain that had taken everything from him, one small thing at a time. I put Robert on a comprehensive protocol. The morning drink was the foundation of it. I asked him for 60 days of absolute consistency, not 58, not 60 days with a few gaps, every single morning. He called my office at the end of week 2. He said the morning stiffness, that terrible first hour of the day stiffness that sciatica sufferers know so well, was noticeably less. Not gone, but less. He said he was not sure if it was real or if he was just hoping too hard. I told him to keep going. At week 4, his wife called. She said Robert had slept through the night twice that week. She was crying when she told me. At day 47, Robert went fishing. Not for long. 2 hours on a quiet lake near his home. He sat in a folding chair on the bank. He caught nothing. He did not care. He called me from the parking lot on the way home, and he could barely get the words out. On day 61, 1 day past the 60-day mark, Robert came back into my office. He sat down across from me. He looked like a different person, not just physically. Something behind his eyes had come back. Something I had not seen there during our first appointment. He rated his pain at a 2 out of 10. 6 years of 8s and 9s, now a 2. He told me he had attended his grandson's baseball game the previous weekend. He sat on the bleachers for the entire game, 2 hours and 40 minutes. He stood up at the end and walked to his car. He said, "I did not think about my back once the whole game. Not once. I have been practicing medicine for 22 years. I keep a record of moments like that one. Robert's story is in it, and I am telling you about Robert today because I want you to understand something. He had tried everything the conventional medical system had to offer. He had been failed, not by bad doctors, but by a system that was treating the wrong target. The morning drink treated the right one. Now let me give you honest, realistic expectations for your 60 days, because this is a healing protocol, not a magic trick. During days 1 through 7, your body is beginning to receive consistent anti-inflammatory compounds for the first time. Most people feel very little change during this first week, and that is completely normal. You are laying the biochemical foundation that everything else is built upon. Some people notice slightly less morning stiffness by day 5 or 6. Others feel nothing yet. Both are fine. Keep going. During days 8 through 21, the first real signals begin to emerge. The inflammatory cytokine levels around your sciatic nerve are starting to respond to consistent daily intervention. Most of my patients report something changing during this window, the sharp electric shocks becoming less frequent, the baseline ache softening slightly, the first night of uninterrupted sleep. Not everyone experiences this at the same pace. If you are not feeling changes yet by day 21, do not stop. Your body is still working. During days 22 through 40, real, undeniable change begins consolidating. Patients report being able to sit for longer periods without shifting. Walking distances increase. The morning ritual starts to feel less like a health experiment and more like an obvious part of their day because they can feel the difference when they do it consistently. The nerve is calming, the microcirculation is improving, the tissue is beginning to repair. During days 41 through 60, this is the phase that changes people. The inflammation has been consistently reduced for over a month. The nerve has had sustained nutritional support. Patients in this phase routinely describe their pain levels dropping from 7s and 8s to 2s and 3s. Many describe specific moments, sitting through a meal, sleeping an entire night, picking something up off the floor that they had not been able to do in years. This is where Robert went fishing. This is where your 60-day story begins to write itself. To maximize what this morning drink does for your sciatic nerve, combine it with these 3 simple daily practices. The first practice is the sciatic nerve glide stretch, 90 seconds every morning immediately after finishing your drink. Lie flat on your back. Bring your right knee slowly toward your chest. Hold it gently with both hands. Then straighten your right leg toward the ceiling as far as comfortable. You will feel a gentle pull behind your knee and down your calf. Hold for 20 seconds. Bend the knee again. Repeat 3 times. Switch to the left leg. This movement physically mobilizes the sciatic nerve within its tissue sleeve, reducing adhesions and improving nerve gliding. The second practice is 20 minutes of flat ground walking every single day. Not running, not power walking. Flat, slow, consistent walking on even ground. Walking is the single most evidence-backed movement intervention for chronic sciatica. It pumps fluid into your lumbar discs, drives oxygenated blood to your sciatic nerve roots, and activates the deep, stabilizing muscles of your spine without loading them aggressively. 20 minutes every day. The third practice is removing one inflammatory food for 60 days, just one. Pick the one that is most realistic for you to eliminate. Refined white sugar, processed vegetable oils, refined white bread, and pasta. Any one of these removed consistently for 60 days will meaningfully reduce your baseline systemic inflammation and amplify everything this morning drink is doing internally. You do not need to overhaul your entire diet. Just remove one thing. Before I close, a few important medical notes. If you are currently taking blood-thinning medications, consult your physician before adding daily turmeric and ginger, as both have mild anticoagulant properties. If you are managing type 2 diabetes, monitor your blood glucose during the first 2 weeks, as curcumin has demonstrated mild blood sugar lowering effects in some individuals. If you are pregnant or breastfeeding, please consult your doctor before beginning this protocol. And if you are experiencing loss of bladder or bowel control, progressive weakness in both legs, or numbness in the groin or inner thigh, please seek immediate medical attention, as these are signs of a spinal emergency. I want to say something to you directly before you close this video. I know what long-term sciatica does to a person. I have sat across from hundreds of patients who came into my office, not just in physical pain, but defeated. People who had stopped believing that relief was possible for them specifically. People who had tried everything, spent thousands of dollars, and been sent home without real answers too many times. If that is you, I want you to hear this. Your body has not stopped being capable of healing. It has simply not been given the right tools at the right time in the right way. This morning drink is $1 a day. It takes 3 minutes to make. It requires no prescription, no appointment, no insurance approval. And if you commit to it, genuinely commit, every single morning without skipping, without shortcuts for 60 days, I believe with everything I have learned in 22 years of medicine that you will feel a difference that surprises you. Robert felt it on day 47 on a quiet lake in Pennsylvania. Your day is coming. Start tomorrow morning. Right now, before this video closes, scroll to the comments and drop two things: your age and your city. Then tell me one thing. How long have you been living with sciatica pain? One sentence. That is all. I read every single comment. I respond to as many as I can, and I want you to come back to this video in 60 days and tell me what changed. I will be here. I will be reading. And I am genuinely rooting for every single one of you watching this right now. I am Dr. Ryan Mitchell, and I will see you in the next video.